Hi there, everybody. I am Jennifer Meckles. I'm a reporter here at 9 News, and joining me today is Andrew Romanoff. You are the president and CEO of Mental Health Colorado.
That's correct.
So he's going to join us today because we had a story tonight on the news that looked at an individual's mental health battle as told by his sister. And we can recap that really quick, but we're looking at a case of a shooting out of Frisco, Colorado from earlier this week where police and a member of the public had engaged, and the gentleman, a member of the public, was shot by police. He survived, and the officer was uninjured, from what we have been told by police in Frisco. And we talked to that gentleman's sister tonight. The gentleman who was shot is named Derek Baker. And we talked to his sister, and she says he has struggled with mental health issues for a very long time. And she said, you know, she does not blame the police in the situation. They had a split second to make a decision. But here's the backstory, what led up to this from her family's point of view. So real quick, before we get into this, we have you on tonight because you have quite a bit of expertise in what you do now. And your background is you were a former lawmaker, right?
Right.
Former Democratic representative in Colorado, Speaker of the House, used to come on to 9 News and talk politics with us.
Yep.
Tell us what you're doing today and what this organization is.
So I run a group, as you said, called Mental Health Colorado. We're an advocacy organization, not a treatment provider. We're a nonprofit that really is aimed at changing two things in Colorado. One is public opinion. How do we help more people understand that mental illness is not a character flaw and it's not a figment of the imagination. It's a medical condition. And it doesn't have to be a death sentence. It's treatable. So we want more people to become comfortable seeking care. The other thing we're trying to change is public policy, because it doesn't do much good to seek care if you can't find it. So we're trying to expand coverage and improve quality and increase access, reduce cost, so that everybody who needs mental health care in the state can get it.
What was your kind of first takeaway when you watched this story tonight? One particular case, right?
Well, it was heartbreaking and too familiar. I tell you, there are roughly 1 million people in our state who experience a mental health or substance use disorder each year. A quarter of them experience severe circumstances like the kinds you were talking about. It's worth pointing out, by the way, that most people with mental illness, Jennifer, are not violent. They're more likely, in fact, to be victims of crime than perpetrators. But we also know that every year in this state, about 35,000 people experience a mental health crisis so severe that they pose a significant danger to themselves or others, an imminent danger, under which circumstances we can hold them against their will.
The sister in this situation talked about some of the things on her wish list, right? I mean, it's challenging to be a family member who's trying to help, but there are rules in our state. There are patient privacy laws for these individuals, right? One thing she talked about was it'd be really great to have a couple of things that would make it easier for her to take control. Now, I know that's easier said than done, right?
Right.
I'm just curious, what's something that maybe is being talked about now in the legislature?
Right. So one of the proposals that would address exactly the issue she raised is called an advanced behavioral health order or an advanced psychiatric directive. It's a means by which, if this bill passes, you could, when you're in the right state of mind, designate an individual or medication, the sort of treatment options that you want to get when you're no longer in the state of mind to make that decision. We're proposing that in this year's legislative session. We hope to get bipartisan support and put it on the governor's desk before the session ends.
So essentially, when you are well, when you are healthy, you can come to the conclusion that perhaps there's a time when you won't be.
That's
and
right.
You can, and from what I understand, you can say your preferred medicines, your preferred places of treatment, right?
Right.
Designate somebody to advocate on your behalf and make decisions.
Right.
That sounds kind of like in a situation like Alzheimer's almost, right?
Right.
Or an end-of-life directive.
Right, like an end-of-life directive in which you say, look, I know there'll be a point at which I may not be able to make these decisions, but I can now, and I want to now, and I want to write it down now, and I want the law to back me up on it now. So that when I can no longer make those decisions, some binding legal instrument will act in my behalf.
Okay. Well, we certainly want to hear questions from you folks at home. So in this Facebook Live, please write in the comments section, and Andrew, be happy to try to tackle some of the questions you may have.
You're going to tackle the tough ones.
I'll do my best. Policy-driven specifically, right? That's really the area that you can speak to the best. Let's refresh our page real quick and see if anybody's written in yet. If not, I've got a few more questions as well. We want to double check and see where we're at this point. Excuse me for reaching over you here. We've got one little computer on the desk. Let's see here. Oh, here you are. Let's see if we've got anybody jumping in yet.
We do.
We have a few things. Just a few people commenting, it sounds like, on the bill. So
Yeah.
sounds like you've got some support already.
That's good. If you're interested, by the way, you can follow this legislation and all the other bills that are making their way through the General Assembly on our homepage at mentalhealthcolorado.org. We have weekly legislative updates. You can learn who represents you in the House or the Senate. Tell them to support legislation like this if you support it, or oppose it if you don't.
Is there anything else right now that's top of mind that you guys are taking to the legislature?
Yeah, we have a pretty ambitious legislative agenda this year because we know that while this story is tragic and heartbreaking, we also know that there are ways we can address these issues, especially by investing in prevention and early intervention. We know, for example, that in most cases the first signs of mental illness appear during adolescence. In about half the cases, in fact, by the age of 14. 3/4 of the cases by the age of 24.
So young. That's so young, 14?
That's the point, and that's why we need to get more mental health professionals in our schools, more kids screened, more teachers and other school staff trained to spot some of the early warning signs, and more parents and families engaged in this conversation. So you'll see legislation along those lines as well.
Okay, let's see if we've got anything here too. Can we make sure that when they go back into a drug state, that the wishes are honored?
Well,
That's the idea, though, right? That's the idea of this whole point?
Right, that's exactly the point of having an advanced psychiatric directive.
Is there anything it sounds like that maybe is kind of along these veins already, or is this truly something that we have not seen in Colorado?
So it's not clear right now under the law that the document somebody might fill out and call an advanced psychiatric directive has the weight of law behind it, and that's what we're trying to specify in state statute, so that there is a clear legal instrument that gives hospitals instructions to follow a person's wishes and has the weight of state statute.
Okay. Remember, guys, we are taking your questions. If you have any for Andrew, we're talking about mental health issues in the state of Colorado, policies.
And screening. Look, you know,
screening.
we can't solve every problem with the state law, but you don't have to wait for the legislature to act. If you're worried about a loved one, if you're worried about yourself, if you're experiencing a crisis, you can call right now, as we sit here tonight, 24 hours a day, 7 days a week, a crisis and counseling line. You'll find a link on our website at mentalhealthcolorado.org. You can call the phone number 844-493-8255, 844-493-TALK, and have a conversation with a mental health professional or a peer specialist. Those are folks who themselves have experienced a mental health or substance use disorder. The service is free. It's confidential. If you don't want to talk, you can text the word TALK to 38255 and have the same conversation. We know a lot of kids are more comfortable texting than talking,
Sure.
But we also know that folks are in need of help. This is a service the state set up in the wake of the Aurora Theater shooting a few years ago.
I saw one person make a comment about supportive housing. One thing that the sister in my story tonight talked about was trying to keep track of where a brother's living, and sometimes he didn't have a place to live.
Right.
And that was another long-standing issue they had been dealing with was, is he safe? Does he have a roof over his head? Can you talk about that issue a little bit?
Yeah, it's a huge gap in the system right now, and the person writing in, and your thoughts, I think, are right on target here. We don't have enough housing or supportive services for folks, especially those who experience a severe mental illness. Instead, unfortunately, tragically, expensively, we've turned our criminal justice system into a warehouse for people with mental illness or drug or alcohol addiction, which is not just the most expensive, it's also obviously the least therapeutic environment we could pick. So we're asking the legislature and the governor to increase support for housing and designate services that help people who are in need of care.
Again, we are taking your questions. We are here with Andrew Romanoff, who is with Mental Health Colorado. Thank you for being here today.
Absolutely.
This is a really important issue to you, you've told me.
It is, yeah, to me and my family, and frankly to too many families around Colorado. I lost a very close relative, a young woman I thought of as my kid sister. My first cousin died by suicide 4 years ago on New Year's Day. Unfortunately, while her mom and dad and I were celebrating the holiday, she walked into our backyard and killed herself. Somebody told me, when you die by suicide, you're not ending your pain, you're transferring it. So I know for my family and for every family who's been hit by suicide, we will spend the rest of our lives tortured by our failure to prevent her death. I joined this organization 3 months after she died because I wanted to spare other families this anguish. Colorado, as you probably know, has one of the highest suicide rates in the nation. Suicide itself has become the leading cause of death among adolescents in Colorado.
So scary.
We saw a 9-year-old boy die by suicide in Denver last year. And the only good news here is that it doesn't have to be that way. We put up on our website, if you go to mentalhealthcolorado.org/screenings, you can take a self-assessment if you're worried about depression, anxiety disorders. We put up a screening tool for parents to take if they're worried about their kids, one for kids to take if they're worried about themselves. These aren't formal diagnostic tools, they're just quizzes, questionnaires.
Sure. Maybe you're concerned and you want somebody else to kind of just weigh in a little bit.
You do, or you want, or you're concerned about yourself, and you fill out the series of questions, and then the survey will tell you, here's what you might be going through, and better yet, here's where to turn for help.
We've gotten a couple more questions in the last few minutes. Let's go through these and see if there's anything else we can tackle. You want to scroll for me closer to the computer here?
I'll use my skills here. Lobby in our government, so underrepresented and needed, just as important as diabetes, heart disease. It's directly related to the opioid crisis and gun violence. You know, it's a really good point because I think a lot of folks treat mental illness differently, and they treat people who experience mental health or substance use disorders differently from the way they treat folks who experience any other kind of physical disorder. The truth is the brain is an organ, it's part of the body, it can malfunction. And we ought to regard brain disease the way we treat heart disease or lung disease instead of stigmatizing or demonizing or criminalizing folks with mental illness. I think that's a good point.
I hear that a lot, that we treat it differently than we do other diseases.
We do, and I think it's, in part it's because we don't understand the human brain as well as other parts of the body, and we fear what we don't understand. Somebody writes in to say they're the parent of a survivor. It's really important for parents to get medical durable power of attorney for their children regardless of their age.
Which was challenging once they become an adult.
That's right.
That was a sentiment this woman shared with me tonight, is her brother's an adult, and there are patient privacy laws, you know?
There are, and again, unless you pose an imminent danger to yourself or others, the government doesn't have the right to hold you against your will.
But there are things that happen before you are posing a danger, right?
That's exactly
where
right.
People want to intervene.
That's right. And that's why I think treatment and screening and diagnosis is so important. I wish I could tell you tonight that Colorado was leading the nation in this field. We're not. We're somewhere in the middle of the pack.
Okay.
The good news here is we used to be near the bottom. We're making a little bit of progress, just not fast enough. I tell my team at Mental Health Colorado, there's no reason on earth that this state shouldn't be #1 in this field. We're not there yet, and we need help to get there.
Goal to aspire to, though.
Don't you think? I mean, we are a highly educated, affluent state. We ought to be leading the nation, not lagging it.
There is somebody who just asked about veterans and dealing with mental health issues in that population. I'm sure that is also, that is a segment of the population that is worth probably talking about too, right?
It's agonizing to me that, and I think to anybody who has seen suicide rates within the veteran population far exceed the rest of the population, in fact, double the rate. We were not long ago losing about 22 veterans a day by suicide, and there's much more we can do. In fact, I was talking to a fellow named Ty Carter who won the Medal of Honor. He was on a nationwide crusade to remove the word disorder from post-traumatic stress disorder because he thought, well, gosh, given the sorts of traumas that people in our armed services experience, stress is a natural reaction, and calling it a disorder might discourage people from acknowledging it.
Like it's something wrong that can't be talked about.
That's right.
Interesting, interesting. While we scroll through and see if we have any other questions here, anybody else that wanted to?
Somebody says, please don't ever be afraid to ask your children questions, and that's probably the most important advice you could get. I know that some folks are uncomfortable talking about these issues with their kids, or fear that somehow if you ask a kid a question, have you thought of harming yourself?
You plant an idea.
You plant an idea. That's not the case. The most important thing you can do is talk, and better yet, listen to your kids. It's why we put up the screening tool I mentioned earlier for parents to take if they're worried about their kids. It's why we put together a toolkit. If you go to mentalhealthcolorado.org/school toolkit, you'll find a series of 10 evidence-based practices that schools can pursue to engage parents and families and teachers and other staff and students themselves in making mentally healthier environments.
Okay. Some good advice.
And people are saying, if you're hurting, please reach out.
Where do I go to get the quizzes? Why don't you tell people again, because somebody wants to know.
Yeah, I'm glad you asked. So if you go to mentalhealthcolorado.org/screenings,
Okay.
mentalhealthcolorado.org/screenings, you'll find a series of about a dozen self-assessments. Again, depression, anxiety disorders, eating disorders, substance use disorders. We put screening tools up in both English and in Spanish so that folks can fill out these surveys and learn what they might be going through and where to get help. In fact, there's a Need Help tab on the website that walks folks through lots of available resources.
There's so many things you can do.
I hope,
go pursue that. Okay. What else do we have here?
Somebody's asking about meds for a 15-year-old. Too young to be in daycare, not mentally able to be by herself. And we do have a Need Help tab that directs people to services for kids. I think that's important to know. Somebody points out the forms for medical power of attorney can be downloaded. And somebody else makes the same point we were just talking about, Jennifer, about help in schools. I'll tell you, I just met today with the State Commissioner of Education, and we pointed out that if Colorado wanted to meet national recommended ratios given the size of our student population. We've got 900,000 kids in our schools, covering about 178 school districts and 1,888 schools. We would need twice as many school counselors, twice as many school nurses, twice as many school psychologists, and 5 times as many school social workers as we have right now.
So literally double everything, and then 5 times as many counselors,
School social workers, yeah.
That's
Yeah, there's a cost to making those investments.
Sure, of course.
But there's a bigger cost not to.
That's a lot of needs still.
It is, and we've talked to schools, especially in rural Colorado, where mental health professionals are even fewer and farther between. We're trying to invest in telehealth and the high-speed broadband infrastructure to get there.
Where you can like face-to-face with the doctor
Exactly.
online.
Right.
Okay.
There might not be a psychologist or psychiatrist physically available, but you can make one virtually available in every part of the state.
Interesting.
We need to increase the workforce here too.
What while we scroll through here, is there any other? Well, let's see if there's any other questions first.
Somebody said it's okay to talk about suicide or self-harm. It's not going to cause it. It will open the dialogue.
I have had a lot of mental health professionals tell me that because parents are very worried about that.
Absolutely.
It's good to know.
Somebody says we need to start improving the facilities themselves. By some counts, Colorado has only about half as many psychiatric beds as we need. The numbers are a little hard to come by, but at least our best guess suggests that Colorado ranks in the bottom quartile of the nation in the number of psychiatric beds per capita.
Wow.
Not everybody with severe mental illness needs to be hospitalized, but
Sure,
there are some folks who do. Good places cost more. School counselors are not helping, somebody says, at all. And it's not a panacea. Just to put a counselor in a school, you've got to make mental health, social and emotional learning part of a school's culture, curriculum, and budget. That's what our school toolkit is about. I want to say we could start even earlier, and I know folks are asking about kids. The signs, as I mentioned earlier, of mental illness appear during adolescence, but the causes are taking shape in some cases during early childhood as a result of adverse experiences. So we're developing a toolkit for pediatricians, parents, child care providers, and other folks who are serving kids between birth and 5 to try to help develop better social and emotional and mental health among the youngest kids in Colorado.
There's a person who wrote on here talking about just the stigma around this in general. We kind of touched on that earlier, but that seems to be such a huge barrier for so many people, right? Just being willing to talk about it, being willing to bring that conversation wide open.
Yeah, I'll tell you both a statistic and some personal evidence here. So we know that every year only about half of Coloradans who need mental health care get it. Most of them who don't say they couldn't afford it, or they didn't think their insurance would cover it, or they had insurance but couldn't find a provider who would take it. But more than a third of people who tell us they didn't get the mental health or substance use services they needed said they were worried about what might happen if someone found out, or they weren't comfortable discussing personal problems even with a health professional. In my own family, I can tell you, because you were asking earlier about my little cousin, in the note that she left us, we found that after we found her, she said, "Please tell people it was a car accident." Because I suspect even in death she wanted to preserve her reputation. She didn't want to be known as someone who was
Struggling with mental health.
Exactly. So she came up with a cover story, which we couldn't honor. But I think it afflicts a lot of folks, this stigma. One of the reasons we put up on our website a story bank, a series of stories from people who have actually gone through mental illness or experiencing, in some cases, mental health or substance use disorder, is because we wanted to show there is a light at the end of the tunnel.
Look, here's someone else's story.
Who's been there.
Read it. Understand it's not just you.
Yeah, let's demystify
Wow.
this. Maybe we ought to ban the term mental illness altogether. Maybe we ought to talk about brain disease, as I suggested
It's a
earlier.
totally new name.
Right.
Rebrand it.
Instead of
Interesting.
suggesting that it's all just in your head.
Yeah.
There is a biological, biochemical, neurological, physiological basis to these diseases.
Interesting.
We had to acknowledge that.
Let's go back to our comment section here, folks. If you've got anything you'd like us to try to tackle tonight, we'd love to hear from you.
There's more questions than we can tackle here. I moved to Nevada 3 years ago. The services here are horrible in Nevada. So they're saying mental health services in Colorado is better. And that's good to know.
What about somebody here is talking about the cost of some of these treatment? Do they say facilities, places for kids?
Yep.
Is cost a huge barrier for people?
It is. It's the number one barrier. In the survey I mentioned earlier, when we asked people why they didn't get the mental health care they needed, the number one answer is cost. And the challenge here is that these insurance plans, at least in most cases, are supposed to cover mental health treatment. In fact, the law says they're supposed to provide equal coverage for mental health and physical care.
Do they?
No.
Why?
Because we're not enforcing the law. That's my take. I mean, a law is just a paper promise unless you actually implement it. I know I sound like an infomercial now, but if you go to mentalhealthcolorado.org/survey, mentalhealthcolorado.org/survey, you'll find a questionnaire in which we ask, did you try to get mental health care? Were you denied? What insurance company denied you?
Interesting.
And why did they deny you? What did you do next? We put that survey up not out of just some academic interest, but instead because the Division of Insurance, which is a state agency that's responsible for enforcing these insurance laws, asked us for evidence. They said, we can't investigate rumors or anecdotes. You need to bring us actual complaints. So if people are not getting the care to which they are legally entitled, we want to know about it. And
Because then you can take it to somebody.
We can take it to the State Division of Insurance. Better yet, actually, we created in the legislature last year a mental health ombudsperson, an ombudsman who will serve to help people who are struggling to get mental health care, whether they have private insurance, public insurance, or no insurance at all. That office should be up and running shortly. A one-stop shop for people who are struggling to get care.
Interesting. In the capital?
Well,
in the state?
In the state government, right.
Wow, okay.
Through the Office of Behavioral Health.
Okay.
Yeah.
There we go.
We want people to get the care they need, and frankly, we shouldn't have to go back to the state capitol and get the legislature to pass another law that says, we really meant it when we passed the first one. We had to start by enforcing the laws we've got, and the laws say insurance companies, you have to provide equal coverage for mental health care as physical care, and you have to maintain an adequate network of providers so that people can actually get the care they need before it's too late.
How long have you had that survey up? Has anything come of
Yeah,
that
we've
yet, or
gotten
is it still pretty new?
So we've gotten a couple hundred responses to that survey,
Wow, a couple hundred.
and we're sharing that with the Division of Insurance. The fact that an insurance company denies a claim doesn't mean the company broke the law, because
Sure.
there are legitimate reasons for denying claims. But it looks like, and it's not just our impression, the evidence suggests that people are having to go out of network for mental health care 7 times as often as for physical care, because there aren't enough providers in these networks. And that shouldn't be a surprise. It turns out that mental health professionals are, no surprise I suspect to people on the line here, being paid less. The compensation rates, the difference between mental health and physical care providers is significant. There's about a 20% pay gap nationally, a 40% pay gap in Colorado.
Wow.
So we need to close that gap too.
Okay. What else do we have here? Lots of good responses. Thank you, everybody who's been writing in. We're trying to get to as many of these as we can here.
One person says laws need funding, and that's true. And the good news here is that in Denver, in Larimer, in Summit, in San Miguel counties last November, in half a dozen other counties and school districts across the state, the voters said yes to funding. Denver had a measure, Caring for Denver. Representative Leslie Herod was the leader on that effort that helped us get, in this city and county, $45 million a year for mental health and substance use services. Larimer County said yes. And about 10 of the 11 communities that asked voters to fund mental health care, the voters said yes. Yeah, people get this now.
That's got to be encouraging to people in your position, right?
Yeah, we're not a treatment provider, so we're not going to
Sure.
get funded by these measures, but we want to...
In the issue of mental health.
That's right. Yeah, it's critical because the truth is too many people are going without the care they need, and instead we're turning our jails, our prisons, our emergency rooms, our cemeteries into destinations for people with untreated mental illness, which is tragic and avoidable.
Okay. Well, let's see if we have any others. Probably we'll start wrapping up pretty soon, but if you have any other last thoughts you'd like us to dive into.
This question touches on something we were just discussing, Jennifer. Becky says, even when we find insurance for mental health, we have trouble finding providers who are willing to jump through the hoops to accept insurance. And that's a huge problem. We've heard from mental health professionals who tell us, look, I'll take these reimbursement rates the insurance company's offering, I'll jump through the hoops they're setting up, I want to join the network, and then they get turned down. They're told by the insurance company that their network is full, even though there are policyholders waiting in line to get care. So we want to hear from mental health professionals too. If you're trying to get on an insurance network because you want to provide care, thanks. We want to make sure you can actually get on those networks and provide care. And we know that folks are waiting too long and traveling too far and paying too much to get the mental health services they need.
That same person writes that that is so discouraging for those who are so discouraged just by the challenges that they're dealing with. Do you have any words for them?
Yeah,
Just keep trying, keep pushing.
Well, yeah, help us either enforce the laws we've got, and if that doesn't work, let's change the laws. Let's put in place a set of penalties for insurance companies that break the law, so that people can actually get the care they need. You know, the law that requires equal coverage for mental health has been on the books for 20 years. So it's about time, I think, that we start enforcing it.
Okay.
Somebody else points out, Wendy says on the Western Slope, they only have beds for criminals. So unless you're doing something drastic, you can't get it. I've heard that from parents who say, look, if my kid commits a crime, then he or she will be incarcerated, and at least there'll be a roof over their head. That can't be the way to go here, right? So instead, we ought to make sure that we divert people from the criminal justice system if they don't belong there, that we improve their transition when they're released or paroled, that we provide the care they need while they're there, not just for people who are incarcerated, but for everybody
That
in
is
Colorado.
something that the sister we talked to tonight talked about, was that until something drastic happens, it was hard for her to get anybody to be able to really do much when it came to her sibling. And then after they were released from jail or the hospital, sent right back out into the world again. And if they don't stay, consistent with their medication, it's just a cycle.
Exactly right.
And it always escalates to a point where the only time somebody's getting involved is if it's really drastic.
There's some good news on this front. I'll see if I can tell you quickly. I mentioned earlier that about 35,000 people in Colorado each year experience a mental health crisis so severe that they pose an imminent danger to themselves or others, or they're considered gravely disabled. And those are the circumstances in which we can hold them against their will for up to 72 hours. Here's the catch. When the 72 hours are up, their mental illness isn't cured, and they're often on their own. So what we asked the legislature to do last year, and the legislature agreed, and so did the governor, is to create a team of transition specialists. So folks who are ending those 72-hour holds can actually at least get some assistance with housing, as somebody asked earlier, or treatment, support services. The legislature said yes, almost unanimously, to creating this team of transition specialists so that we can break the cycle that you're describing. That's the good news. The bad news is we only found enough funding in the budget to help about 350 people in the most severe circumstances. There are 35,000. You need it.
Right.
So you could
350.
So you can look at the glass as 1% full or 99% empty. We're going to go back to the legislature in the months and years to come to try to make sure that everybody in Colorado in those circumstances can get help.
Okay. Well, we really appreciate you coming on to help us with this tonight.
Thank you.
Sorry for those of you we weren't able to get to. We're going to, I think, continue to kind of look at this issue. We're going to cover this story again in our 10 o'clock newscast tonight on 9 News. Andrew Romanoff, thank you. We really appreciate your perspective, your thoughts, and helping us answer some questions.
Thank you very much.
All right, everybody. Have a wonderful evening.